I'm Daniel Yoder. I'm a family doctor in Hendersonville, North Carolina. I work at Blue Ridge Health, which is an FQHC in Hendersonville, North Carolina, and then work with MAHEC, which is a family medicine residency program in the Western North Carolina region. We just heard from Dr. Kim about dealing with gravity and hard things, with the gravity things that happen to us with grace. I'm going to share about one of the hard things that happened to us recently in Hendersonville and in Western North Carolina, and some lessons that I learned from it, and how God was faithful to us in the midst of that. I do want to give credit as I start. Some of this material was pulled from information that I got from a family medicine doctor in residency in California that went through a wildfire, and some of their lessons learned from that they shared with us when we were in the midst of that. So my objectives for today are to tell our story, to describe some best practices in disaster preparedness for community health centers, free clinics, and just life in general, because these things happen to us when we least expect it. Consider some best practices for preparedness, and then offer some new tools or protocols to consider. And these are very simple things. There's not, it's not high tech. It's not a brand new thing, but it's things that I had not thought about before we went through the effects of Hurricane Helene. But now that I've been through that, want to make sure that others know and think through these things when they experience them. Just out of curiosity, for those in the room, how many of you have been through a natural disaster of some sort, hurricane, wildfires? Yes. So I grew up in the Panhandle of Florida, which usually experiences bad weather, but I had never experienced a hurricane. And then I moved to Tennessee. I worked at Dayspring Health in Jellicoe, Tennessee, one of the FQHCs that's here. That's kind of how I got connected into the CCHF community before moving to North Carolina, and then moved to North Carolina in 2020. But after I'd left Florida, my parents experienced Hurricane Michael in 2018, which was a devastating kind of Category 5 hurricane. And I can remember feeling that thing that happens to us sometimes when we have a significant part of our family that experiences a natural disaster or mass casualty event, and you're not there to process it with them, and you kind of have this like prolonged grief experience because you're processing it from a distance. I no longer feel that way because now I've experienced my own natural disaster with my family and my community, and now I'm kind of living the experience that my parents and brothers and other family members experienced back in 2018, which is not something I would wish on anybody, but it is something that is one of those experiences of suffering that helps us know ourselves better, helps us grow in resilience, and helps us really serve and minister to those around us. So just to kind of tell a little bit about our story and what we experienced. I know you saw pictures in the news and heard about all the things that were happening in Western North Carolina and South Carolina and other parts of that region. But we got a lot of rain in the few days prior to the storm arriving. I think it was like 24 plus inches of rain in 2 days was what I read after the fact. I don't know. I can't quote my exact source on that. And then on the heels of all that rain, the Hurricane Helene quickly traveled up through Florida, Georgia, South Carolina, North Carolina, with really sustained winds still even that far inland, which was unusual. And where we live, we're right on the Eastern Continental Divide. Water on one side flows to the to the Atlantic Ocean. On the other side, it flows into the kind of Tennessee River Basin and then onto the Mississippi. And so that water got concentrated in that area just because of the way the mountains and the valleys and the streams built that up. And there was also a reservoir that burst that really caused the devastating flooding in Asheville. We're about 30 minutes south of Asheville. Did not experience as much flooding as they did, but this is the road that I use to go to work most days, and those are my kids standing out in front of that light. And then we had some big trees in our yard. We did not have any major house damage, but lots of cleanup. But certainly many people in our neighborhood, in our community in Hendersonville that had large pine trees through the middle of the house, that type of situation. And then just down the road from us, people that were being rescued with canoes and boats from their homes. And significant needs. I happened to be on call for the hospital that day, and I needed to go to the hospital to attend a delivery with one of our family medicine residents. And so I was driving in the middle of the storm and got there in time. And then while I was away was when these two big pine trees fell down. And then when I came back home later that day, I almost couldn't get home because so many trees were blocking the road to get back home. But what I wanted to highlight was some of the things that went well for us, and a lot of it has to do with just being available and willing, and really having coworkers, people that want to serve those around them. In our family medicine residency, our kind of mission statement encapsulated is training to serve. That's what we want to do. We are not a faith-based residency or a Christian residency, but we have a lot of people that come with either faith commitments or just a strong desire for humanistic reasons to serve. And so it was wonderful to see how that that underlying philosophy, kind of life mission really manifested itself in the midst of this experience. We didn't have any power or water for a good week for most of Hendersonville, some areas around us even longer than that. The hardest thing, though, from being a medical person was, and in healthcare, was that we didn't really have good communication. Cell phones weren't working reliably, and you saw the picture that Dr. Kim put up of pagers. We didn't have pagers anymore. We wished we had pagers in that moment, or we wished we knew how to do amateur radio operations as well. And that cell phone service problem went on for about a week as well. And so our solutions were really showing up in person. To be able to help in the hospital or the clinics, you just had to go and see. And we didn't have great ways to check on each other and know how we were. So you kind of also had to go and see how your staff was and how your residents were doing. And some of our other solutions were really just finding ways to help our neighbors as well. I have countless stories of staff or faculty bringing each other water. I was brought water and food and chainsaws. Because we didn't have power, most people were cooking outside over their fire pit or their grill, and there were lots of wonderful potlucks that happened kind of out of that. And then the other kind of providential solution that happened was that one of our residency faculty members had created a WhatsApp group text for like sharing social information and even like medical knowledge. And that ended up being the way that we could communicate with each other most effectively, because it didn't rely on just on SMS capabilities, but it kind of could use Wi-Fi and to send those messages as well. It was just a more reliable way to communicate in that moment, but still not perfect, and still wished I had a pager in that moment so that I could communicate with people easier. This is just a picture that kind of represents the swath of Hurricane Helene that was affected. I had not seen this picture until just a few days ago to realize that the large area of places where electricity just wasn't available at all. It includes, the upstate South Carolina and a large portion of South Carolina, even more than what's affected of North Carolina. After that first hurricane happened on Friday, I think, and so a lot of the clinics were closed. And a lot of the work we were doing was in the hospital, in the emergency department helping out. You just had to stay there because we couldn't rely on cell phones at all. In the following week, we weren't sure. We were just going to help in the hospital. But the other thing that I was most proud of was the creativity that came out in that moment. Residents came in to do extra shifts in the ER. I think our residents thought it would be a good idea to figure out who our high-risk patients were, who was on oxygen, who might have critical medicines that they might run out of, like insulin, and to kind of pull the group and say, who do you need us to go check on? We'll pull those names, and we'll go get in a vehicle and drive around and take food and water and make sure that those high-risk patients have their needs met. And then there were some areas south of us that were affected even more by the hurricane and power outages. And so Blue Ridge has a mobile van. We were able to take that mobile van and set up in a grocery parking lot and just provide food and water and basic medical care, because the clinics, we didn't have power. We couldn't use EMR wasn't important in that moment, didn't need to use it. So we were able to meet needs in that way. And also the other thing I left out of that was there were 2 shelters set up in our county, and the county health department had nurses that were there, but there were no medical providers that had come there by the second or third day. And so we kept going there on a daily basis, and we're writing paper prescriptions when needed, and addressing basic medical needs from injuries and things like that as well. And then there was another shelter north of us, an even larger one, that one of my colleagues said, we should go check there and see if they need anything. And I think, that was probably day 5 or 6. And when we went there, there were Red Cross nurses there, but there hadn't been any medical providers there. And we were able to partner with one of the Asheville Buncombe Free Clinic, who had a pharmacy with ample medications and didn't need to worry about reimbursement and insurance and all those things. And that was an example of how a free clinic actually was really a lifesaver for those patients, and even enabled us who don't work at the free clinic to connect with them and meet the needs for the patients, using paper scripts and writing those and having a courier deliver those to the shelter. Was a really powerful way to meet the needs in that moment. And those efforts, the home visits, the shelter work, continued for really about a week and a half, almost 2 weeks. And at that point, we realized, we had power back, we had internet service back in the clinics, and there was kind of this tipping point. Do we still need to keep doing the things we're doing with home visits or shelter visits, or do we need to open the clinic back up and bring people in? So I think it was about week 2 that we decided to open the clinic back up and have people come back in. And at first it wasn't very busy, and then all of a sudden it got busy, and it was like back to normal. And it was almost, in some ways, it almost was painful. Like we were doing all these other things that were kind of enjoyable and fun, and then all of a sudden it's like, oh, you got to back to work. And then even being told by some of the shelters, like, we don't need you anymore. You did all this stuff. We're bringing in these outside groups to do that, which they're qualified and trained and have the resources to do. But it was one of those like, oh, I really was happy to do this service that I was doing, and to lose that opportunity. But we have to get back to work and do the things that we're doing. So by week 2, we were back in that kind of normal framework. The other thing we did in this moment that I'm really glad we did was make some time during our residency didactics. And we weren't trying to teach anything in that moment. We were just trying to survive and meet needs of those around us. But we made time for them to sit down with our LCSWs or clinic counselors and just share stories and talk and process what they went through. Because it was hard, when you have people that are worried about their safety, or their family couldn't get in touch with them and they were worried about them, or they're worried about their animals, and then saw hard things. We saw people suffer. So it was good to have that time and that space to process and care for each other emotionally. This is a service map that just shows where Blue Ridge Health is. We're in Henderson County. We're kind of towards the left-hand side of the screen, but there are multiple sites. And because there are multiple clinic sites, we were able to have an impact in meeting needs, not just in Henderson County where we're primarily located, but in a lot of those other places. And then this just reflects that kind of by that week 2 mark, we were able to reopen clinics, still providing lots of food and water, and even clothes and things of that nature. I was thankful for the leadership at Blue Ridge. They let a lot of the staff just bring their kids to the clinic and, run around and read books and watch movies on the projector while the staff were able to do other things. So I think they, bent their policies in the moment about a lot of those things, which I think you have to do in a disaster, bend policies. One of our clinic sites had a generator, like a diesel generator that ran the power, so we did not lose those. We did lose some insulin at our other clinic site for that reason, And I think somebody had the foresight to like grab the vaccines and move them over to the other location. You know how critical those those fridge temps are for monitoring that. Knowing clinic operations too much, I know some of those fridges will have like a backup generator for a period of time, or at least alarms that go off when when it reaches below. The other thing I forgot to mention in that first week, or like really the first days after, just like in any large clinic, you always have some people that are away on this was end of September, people that are away on a trip or on vacation somewhere. And some of those people couldn't get back. They couldn't fly back, or they couldn't travel back, or they didn't want to travel. They didn't want to travel back, and which they shouldn't have. But they were thoughtful enough to offer to cover our desktops in the EMR remotely with a cloud-based EMR. This is one of the times when a cloud-based EMR is really helpful. So they offered to cover that. So they were able to, open up everybody's desktop and manage those. Not that the pharmacies were open necessarily, but, some were. They could manage those prescription refills, certainly manage any outstanding messages. And that was a huge help, like having that weight lifted off of you of not being able to to check your inbox in the EMR was a really a big help in that moment. So it was nice that they had the character and the foresight to offer that. Nice to have the flexibility for somebody to do that as well. So just to kind of recap what went well, communication was hard, but there was creativity around communication. And I think that was a lesson learned, especially in terms of always having backup ways to communicate. Engagement around service was really fantastic. I was so proud of the people I worked with. One of those moments where you didn't have to tell people what to do. They just kind of did the things that they needed to do. And I think that speaks to the importance of the culture that's created in our clinic spaces, whether it's a free clinic, free and charitable clinic, or an FQHC. And then also problem solving in the moment, really trusting each other to come up with creative solutions, not falling back on like a chain of command structure necessarily. A lot of our good ideas were coming from our resident physicians, from our clinic staff about where to go and what to do. And so really letting that creative problem solving come from all levels of the organization was really, really helpful, and something I would highly recommend. And then caring for each other emotionally, whether that was that session that I mentioned, you talked about vaccines. There's a lot of food wastage that happened in that moment. And to prevent some of that food wastage, there were attendings and faculty members that were bringing food to the hospital where there was a refrigerator and saying, "Here, have these frozen dinners, have this food," because there certainly was a food shortage within the hospital for the staff. The cafeteria wasn't really able to meet the needs of the patients and the staff both in that moment. I had heard this quote when my parents went through the hurricane in 2018 from about looking for the helpers, and you always find those people that are helping in a disaster. And I never knew the source of it until this natural disaster. Fred Rogers, who's one of my favorite people ever, is who gave us that quote, and I think speaks to just how important it is in a natural disaster. We all have to do different things. Sometimes we have to leave. Sometimes we have to go somewhere else for our safety or our family's safety. But one of the best ways, I think, and evidence supports this, the best ways to recover after disaster, physically, emotionally, spiritually, is to be a helper, to engage. If that's the one in your community, or if it's going to help others who are also in need. But then there are certainly things that could have been better, and these are things that I would want to prepare for in the future. We realized about a week or two in that we really hadn't connected with the incident command for our county, and kind of asked permission or blessing to go to these shelters and do these things. They were grateful that we were there, but we could have collaborated and connected with them better. I think we could have done a better job of pivoting to recovery needs. We did a lot of great things in that moment, kind of that heroism in those first week or two, but then we just kind of got back to business as usual in a way. And I do wonder, even thinking for myself emotionally, I wonder if that's part of why 6 months later I'm kind of struggling to know feeling a little bit of that disillusionment, maybe because I haven't stayed engaged in a recovery process for the community, whether it's, helping neighbors or doing those sorts of things. And to second that, kind of staying in an ongoing connection, because the greatest need now is what you mentioned, like there's still tarps on the roof. People still need help with housing, with infrastructure, with debris cleanup. There's still those things that are needed. And then spiritual care and in that rebuilding process, I think is also something that could have been better, both in the moment and still even now going forward. And this is what I wish I had remembered in the moment, that God is our refuge and strength, a very present help in time of trouble. His presence was felt by me in that moment. I remember waking up at 4 a.m. when it was just windy and rainy that morning. And I think in my 1-year Bible, I happened to be at the passage in 1st or 2nd Samuel where Elijah's in the cave and he's listening to the wind, and hears the earthquake, I think, and he's waiting for God to speak to him. And God's voice wasn't in any of those moments, but God's voice did come to him in a small whisper. And I definitely heard God on that day in the moment, and then have continued to hear him. But it's also true in the midst of devastation. It is easy for any of us to find our refuge and our strength in other places or to despair. And I need to remember that God is my refuge and strength. And then this is a graph, and you can find these in multiple places, that represents kind of what recovery looks like for a community after a natural disaster, whether that's a wildfire, a tornado, a hurricane, a violent event that affects multiple people. And then on this side, you can see some of the preparedness things that are really important. On the other side, you can see that short-term recovery. We're kind of in that intermediate recovery period, but then there's also a long-term recovery period that's really important for helping communities build resiliency and even emerge from these disasters stronger. I think we've all heard multiple stories of places where in the moment it seems like they can't rebuild, or they shouldn't rebuild, or it's just too much. But then stories of years later how that community actually is stronger in that moment. But it is a long process. All right, I wanted to stop and give time for some engagement. Maybe pair up with the 2 or 3 people on this side and share any personal experience with the disaster. Maybe think through some of the things that I pointed out there and think about where your team might be vulnerable, and then who you would call for help or engage kind of in that first 12 to 24 hours after disaster. For the sake of the recording, we just finished our small group activity that I did not speak into the microphone at all. So thank you for your participation. So the things that I've learned, and in my reading, I think this is an opportunity as we're recovering to think about building capacity, being prepared, not necessarily running a disaster drill, but just talking through your plans kind of in a tabletop scenario. Establish communication systems and backups to the ones that you have in place. The one thing for us would be to integrate with our local incident command for disasters. Practicing servant leadership before, during, and after is really important. And I think should rise out of our faith. And then developing systems for spiritual and emotional care ahead of time, so that those opportunities are there for your staff. These are some of our residents that were out on the home visits or with the van, staying engaged. These are some tips about kind of learning about your community emergency plans. There is, I think every county, oftentimes, at least in North Carolina, it's housed within like the county health department. There's an incident command person, and you should be able to get that information if that's something that you want to investigate. And they can decide whether or not to include your clinic or your organization in the call system. I did find in our experience, like if you show up and you're local and you want to help, they're probably going to find something for you to do. And so I'll let you decide how important that is to establish that ahead of time versus not. I think if you can build that connection ahead of time, then you can maybe minimize some duplication of efforts and too many people being in one place and not enough people in another place. Calls from people within our service area that wanted our help, but then also I think calls kind of far flung areas where they couldn't get food or water. And I think somebody in our organization rented a helicopter and flew in and did something. I wasn't a part of that. But then, and there was somewhere in Western North Carolina where they were, I think there's this recovery organization that has mules, and they brought in their mule team to, you probably saw pictures or heard about that too. So, I mean, that's certainly a creative thing. I've always wanted a mule. Maybe someday I'll have a mule. And then the other thing is to tech-proof your contact list. I heard you mention a contact system that you use in human resources. I know we have one called Everbridge that can communicate by both text and email, but it didn't work in the moment. And so having the recommendation was to have a paper copy with everybody's contact information, and then even a kind of a tree of who calls who. This person calls 5 people, this person calls 5 people, or drives to their house to check on them is the other option. The system that we had did work, but I think it took 48 hours or so before we truly knew that all of the staff was okay. And when you're in the moment, you would like to know that sooner, because you want to take care of your people first, and then meet the needs of your community. We already talked about the communication, kind of creating some redundancy. I put Everbridge because that's the one I know, but having some sort of system that can communicate. I'm sure there's lots of products out there. I mentioned that we found WhatsApp valuable. I think there's other things like GroupMe is the other one I heard mentioned recently that kind of functions similarly for communication purposes. Signal, yes. Signal is also out there. And then you also want to think about your IT system may be down, so do you have some of this stuff on another IT system? And then do you have paper copies of things that you need? Do you get a pager? Our hospital that I work at, I think it was a little bit too late, but they did actually get some pagers so that ER staff or hospitalists could use those. Prior to that time, you just had to stay in the hospital. If you were on call, you just had to be there. And you kind of had to do the thing where you couldn't call in the hospital either. So you kind of had to do the thing, we'll each go see 3 patients and then we'll meet back here at this time. So that was, another way to be creative and make sure you're still getting your work done. And then think about backups to your backups. We talked about community emergency plans. You can find maps that show where the flood zones are in your community, certainly where the evacuation zones are. I liked your suggestion of kind of where we're going to meet if there's a large scale disaster, and putting that in place or communicating that ahead of time. And then the issue, one of the issues we had, since we have residents and there's always new residents coming in every year, and sometimes they start out in one apartment and they move to another apartment, we didn't always have updated addresses for our learners. And so having that information is really helpful. I think we even did have some medical students that were rotating with us during that time. And so, that's somebody that you may not in your mind think to call or check on, but is vulnerable in a disaster. So having those addresses update, making sure that your staff know that that's important for them to let you know if they move somewhere. I didn't touch on this a lot in our group discussion, but there's always going to be different kinds of risk work tolerance. There are those of us that will want to go to the shelter, will want to, be in the building with all the cots lined up and talk to all the people. There are people that are not going to want to do that, and that's okay. We can't make people do the same things that maybe our colleague is doing. Think about ways to either provide time off or kind of work outside the system that can be done as well. Working in the cloud-based EMR to get some of the tasks done. Having some outside projects that don't involve kind of being disaster facing all the time can be helpful. I put these up there just because I love these are rural competencies that we think about. They prepare people well for all sorts of things, whether it was a COVID pandemic or a natural disaster, on top of the graduate medical education competencies. So the things that stand out in a situation like this are the adaptability, collaboration, integrity, abundance in the face of scarcity, reflective practice, being able to think about what we're doing, and then resilience as well. I'm going to zoom through that. This, I think, I showed another kind of chart earlier, but this kind of graph shows what it feels like when you're experiencing some sort of mass disaster or casualty. We're kind of at about this 6-month mark right now. So and I feel it. I feel this disillusionment, like the blue tarps on the roof, the piles of debris. And so hopefully entering the rebuilding and restoration phase and the opportunity to continue to learn and grow. But we don't all experience, this is not the same for everybody that you'll work with. So some of us experience that collective trauma at different times, or it's longer or shorter. I know for me and my wife, if it's windy outside, if it's rainy, if it's stormy, we're not sleeping well. We're kind of on the edge of our seat, just because we're still remembering and recollecting. I'm looking forward to that not continuing as we get further out from this experience. In conclusion, some lessons learned that are important. I think the one thing I didn't highlight, especially if you're coming from outside to help, or people want to come from outside to help you, is to give them guidance about what would be helpful. It's not usually, initially it's certainly food and water, but then that stops pretty quickly. A lot of organizations want to send clothes and toys and things like that. And it seems very helpful, but we have a closet in our clinic that's full of clothes. It's been, we've had it for 6 months now, and they really haven't moved. They haven't been utilized. Donations to organizations that are going to be helpful is probably one of the most helpful ways that people can be engaged from outside, as well as coming, not in the immediate aftermath. There's certainly disaster tourism that happens, people that are coming just to drive through and look, and that's not helpful. So certainly discourage that. Now, if it's my parents came and brought a generator like 2 days after, if it's that's really helpful. Or parents coming to get your kids and giving them a break, that's really helpful, but not just for the sake of driving by to see disasters. Those relationships, and I heard this mentioned, like relationships with your local partners are really powerful. They need you and you need them, and establishing those connections ahead of time is really helpful. We are running out of time. Here's some resources. FEMA has like a disaster framework recovery thing that can be helpful to look through. This Institute for Collective Trauma and Growth is where that one diagram was from. It's actually, I think it's an organization that's no longer there, but they still got some good resources on their website. And then the National Volunteer Organizations in Disaster helps coordinate all the disaster relief, many of them faith-based organizations that come. And so that can help coordinate, especially in that recovery and rebuilding phase, that process. Okay, and I'll close with the last verse in that Psalm 46. The Lord of hosts is with us. The God of Jacob is our refuge. I hope that none of you experience a disaster anytime soon, but statistically, probably I will again. We will at some point, and certainly, hopefully, I have a new desire to help, be a helper, even if it's somewhere else, to contribute. So, and I can hear that in your voices as well. So thank you for being interested, and thank you for being helpers. I will keep looking for the helpers. Thank you for being here. Thank you for being interested. I really appreciate it.